So today we're talking about the CCO, which stands for the caudolateral curvilinear osteophyte. Caudal meaning back, lateral, the outside. So it's on the back, outside of the neck of the femur. Curvilinear just means a curved line, and osteophyte is just a bone spur. So this is a curved line of additional bone that occurs on the back outside of the neck of the femur. So this here is a caudal view of the femur. So we will go ahead and draw in a few bony landmarks to help us identify this. So we have here the femur. So we're going to go ahead and draw in this here is the lesser trochanter. So this is where the psoas attaches. This here is the greater trochanter. And obviously there's a lot of muscles that attach here. This again is the caudal view of the femur. This here is the acetabulum. This is where the head of the femur fits into, right? The femur connects into the pelvis here. This here is going to be the CCO line. So we'll go ahead and draw that in. That is the CCO, or the caudolateral curvilinear osteophyte. And this is the ligament of the femur that connects it into the acetabulum. That is going to be a problem with a lot of dogs with hip dysplasia, where that ligament is to laxity. Of ligament of head of femur. Okay, so why is this little line here significant? So it's because it's one of the most reliable early indicators of hip dysplasia and osteoarthritis in dogs. So the CCO is the first radiographic change that happened in dogs with hip dysplasia over 75% of the time. So that's why everyone pays so much attention to this small little line here on the back of the femur. So we'll understand why this line forms as we understand what hip dysplasia is. So the coxofemoral joint, which is the hip joint, where the head of the femur, again, meets the pelvis in the cup here, called the acetabulum. Hip dysplasia is when there's an incongruence in the connection between these two bones, right? So these two bones are not fitting perfectly. The head of the femur is not perfectly seated inside the acetabulum. So at the beginning of this process, there's going to be joint laxity. So there's going to be too much movement inside the joint. So this ligament here connecting the femur to the pelvis will be too lengthened and loose, right? So that ligament being too loose is going to allow for that joint laxity and that movement that we don't want. So the head of the femur here is going to move too much, and it's going to move too much primarily laterally, right? It's going to move too much out because it has too much length, so it can start to move further than it should away from the acetabulum. Over time, this laxity can lead to subluxation, which is like a partial dislocation of the head of the femur from the acetabulum, where it's slipping out. Primarily laterally, again, moving away this direction, laterally, away from the body. And to some extent dorsally, so moving upwards toward the back, up into the gluteals. It can also subluxate that way. Eventually, this can potentially lead to full luxation, where the femur is fully outside the acetabulum, where it's fully dislocated away. All of this movement in and out of the joint, moving too much movement around, can lead to a breakdown of the articular cartilage that's going to be lining these surfaces, and then of course damage the joints and bones once it has damaged the articular cartilage, eventually then leading to osteoarthritis. So why is this line of bone, the CCO, an indicator and warning sign for hip dysplasia? Well, we have to think about why the bone spur is forming. The bone spur is the body's response to trauma. It's trying to stabilize the bone. So when there is joint laxity and the dog is ambulating, in fact, we can look at this anatomical model here. So we have here the right hind leg, we have the pelvis, we have the femur, and we have the head of the femur fitting into the acetabulum here. So inside this hip joint, If there is joint laxity, meaning there is too much movement, in fact, we can represent, again, in this model, here is the ligament that is now too lax. It's stretching. It's moving laterally. So when that's happening with every step, when the dog is flexing their hip, picking their foot up to move forward and walk or run, muscles like the iliopsoas, coming down from the ventral side of the spine into the lesser trochanter here, the rectus femoris, major hip flexor, the sartorius, also a hip flexor, coming down here on the cranial side of the femur. They're working to bring the leg forward. So when the hip joint is lax, these muscles have to work harder. Now, why do they have to work harder? Because they're trying to stabilize the hip. So they're working to flex the hip, and there is this instability. So they're doing extra work, not just to flex the hip, but to stabilize the hip. So this puts more force and stress on the cartilage here in the joint. Because the head of the femur is not perfectly seated, it's also putting that force on a smaller area. So imagine here we have the joint, we're looking at the caudal view here. The head of the femur has subluxated partially. It's moved in the acetabulum, it's not perfectly seated. There is now more force being applied to that area of articular cartilage because these muscles are working harder, and it's being applied over a smaller area. So that's a lot of stress on the joint. Now, when the foot touches down, all of the hip extensors, so like the bicep femoris, the semitendinosus, semimembranosus, that hamstring group of muscles, including the gluteal muscles and even the adductors, are going to engage and pull against the leg to stabilize it, to extend the hind leg. So the head of the femur is going to slam back in when those muscles engage. It's going to slam in medially. It's going to slam in back into the acetabulum. So there's a lot of stress and trauma on the femur every time the dog is moving, especially when they're running, and there's going to be a much more stress on that joint then. So the bone, by putting down this little bit of bone here, this CCO, it's trying to strengthen this bone against trauma, so it's remodeling to protect itself. So that's why the CCO is not really the problem. It's an indicator of a deeper problem, which is going to be the joint laxity. When you see a warning sign like the CCO, the more you can do to stabilize the joint, the better your long-term outcomes will be. So things like physical therapy, hydrotherapy, canine fitness, massage, acupuncture, whatever you can do to keep them strong and active, but doing so in a way that will treat and correct the instability and maladaptive muscle hypertrophy and atrophy that happens in the hind limbs that's taking place as a response to these changes they're going to make to posture and gait, the better outcome you're going to get. In some cases, surgery may be necessary or recommended as well. One thing to keep in mind is don't confuse the CCO line with a puppy line. A puppy line can appear in a similar area in dogs typically under 1 year of age, though I've heard of it being mentioned up to 18 months, but usually it's under 1 year and usually significantly under 1 year, more like under 6 months. A line of bone in this area is not necessarily indicative of future issues, future development of a CCO or of osteoarthritis. So the CCO isn't really the problem. It's a symptom of the underlying problem. And the better you can treat that problem, the sooner you can treat that problem, the better long-term outcome you're going to get at preventing things like osteoarthritis. So what else can you do? Weight management is one of the most important things you can do to keep dogs healthy that have a CCO and are at risk for developing hip dysplasia and osteoarthritis. In a 2005 study that looked at dogs, Labradors, with a CCO, they fed some of them a standard diet, and those dogs developed osteoarthritis 100% of the time. In dogs that were fed a restricted diet, so they had a reduction in their calories and were kept quite lean, those dogs only developed osteoarthritis 55% of the time. So that's a really significant difference. So that's something that's quite easy to do, that could be implemented, that can really play a major role in maintaining quality of life for a longer period of time for these animals. Thanks for watching. I'll see you in the next one.